Good day, everybody. How you doing? Is it everybody or just you today? Our one committed viewer. Hope you're good though. But anywho, so you've watched one of our videos and you've been thinking about your teeth a lot, but you just started your internship this year. You know, the rent is tight, transportation, and figuring out everything else. And now you have to think about how am I going to see a dentist? How am I going to get my teeth fixed? What am I going to do? So today we'll just be chatting about things that you can do at home on your own to just help you preserve the health of your teeth until you can actually see a dentist. Welcome to Hills Talk, and my name is Dr. Craig.
And my name is Surprise. Today's
Dr. Surprise.
Dr.
Like,
Surprise.
he never says that.
Yeah, I never say.
It's not like I like saying it.
So see,
It's my work name. Authority. For authority. It's just my stage name at work.
today's talk is going to be very serious. We're talking about money, and you know, uh, let's not pretend South Africa is quite unequal. If you're watching from the States.
Yeah, what's the difference?
What do you mean?
Unequal and unequal.
I don't know. Actually, don't know.
Which one is right?
Unequal.
Unequal.
Yeah, unequal. I think it has to do with like if the first one is a verb. Yeah, yeah.
English.
No, if it's a vowel or consonant.
This is exactly what makes this videos long.
Oh, but today
We're trying to keep the video
today.
short and brief and sweet.
Yeah, but we're quite unequal, and there's a big chunk from different income brackets. So hopefully we do our best to help everyone out, I guess.
Exactly. So it's not just the dental practice in itself that's expensive. If you go to Clicks, Discam, or any other retail store, you will find that some of the dental products can be really costly. You could get an electric toothbrush for 900, 1,500. It could even get to like 5,000 or 6,000 rand. And it's just cleaning teeth, you know? So they all supposedly do similar things, but essentially everything is expensive. But we're just going to talk about some things that you can do at home. For instance, we always recommend to our patients, get a soft brush because it bends easily. It doesn't really traumatize your gums. It doesn't eat away at your tissue, and it doesn't hurt. And the bending also helps because it gets into those parts that a hard brush just can't get into. But hey, you don't want to spend like 50 rand on a brush that you're going to have to like replace, and you would rather spend like say 25. Then I think they have different classifications. There's the hard, the medium, and the soft. The soft being one of the priciest ones, but like the mid range, I think that's the most common. I don't think I've really met anyone who uses hard. If you are out there,
Stay hard.
stay hard, man. You know, I don't know why you're angry.
Yeah.
Yeah, take it easy.
Yeah.
But anyway, this is how you can maneuver your way around having a medium brush. So don't hold it like this, you know, and don't activate your guns for it. Just finger pressure, just use, just not even all of them, just like use one finger to apply pressure and just rotate it around. Make sure that it gets into those gum lines. Don't just brush the white where your gum and your tooth meets. There's a little bit of a gap in there. Like if your gums are swollen, you will see like just that line being like a bit more exaggerated, but just apply a little bit of finger pressure and just rotate around there. All right. It might not be as great as like a soft brush, but it is definitely good enough to remove most plaque and subgingival, or like not, what's the the friendliest word for subgingival, under your gums.
Yes,
You'll be
yes,
able to
yes.
brush under your gums.
Yeah. And you could like you said, you see all these price ranges and it's, easy to get confused and say, well, the more expensive one is usually the nicer one. And it's like, yeah, I mean, but everything, let me tell you the secret. There is diminishing returns, meaning once you get beyond a soft brush, everything else is not going to be significantly better. Like it's not going to be, oh, like driving in a Rolls Royce and driving in a Toyota. Two different things, right? But once you get to like a Bentley and a Rolls Royce, it's like, so that's the same thing. Once you go past 50 rands, it's literally not going to be night and day difference. And another thing you can also do if you have a medium or you can't find a soft brush and you only have a hard, run it under warm water. So that getting some warm water softens up those bristles, so it's easier for them to move around. But finger pressure is good enough, especially for the guys who like to you don't have to use your whole forearm. It's not shoes, it's teeth, so they're very delicate. So finger pressure and do that.
Yeah.
What about flossing? What can we do for flossing? Because I know floss can also be a bit pricey sometimes.
It can be, and there are not that many inside. If you black like me, then you've probably used like orange sacks to, scrub up because you couldn't get that little fancy little scrub thing there. So with this one, you hit two birds with one stone. Two stones upon her. Yeah, you buy yourself a sack of oranges that will feed you. And once you're done, you just grab one of those shandies. You can apply a little bit of like toothpaste on it and just run it through. It's a little bit sharper than like normal floss, but like here's the thing: you don't dig into your gums. Just like a little slide, just
And then rub up and
yeah.
down.
The main reason is that you want to keep those areas in between your teeth clean. All right, and your brush sometimes doesn't reach there, especially if you're using like a medium brush. Even the soft ones don't really get in there. So just that. And a lot of people get cavities right in the middle. Like I know you get them on the top part and you're like, there's a hole there. But sometimes it's right in the middle. So just get that baby, slide it in there, slide it out, gently. Don't like make your gums bleed and like you can't actually floss again tomorrow or something. Just like lightweight, baby.
And this is another thing I've seen in some stores. Like once upon a time, I was in Zerest. Yeah, I said it like that,
Zerest.
And there was no floss at the USafe. So it does happen that there are stores without floss. But you know what? You will always find a sack of oranges somewhere.
Yeah.
And
Even on the side of the road.
Yeah.
Even at a taxi rank.
yeah, yes.
Yeah.
And what matters is the action and not the product itself. And this is also a good segue to get into toothpaste. I mean, I've seen toothpaste for 500 Rand. It's there. It exists. And there's toothpaste for 20 Rand. Is there a difference?
Yeah, there's some differences, but like not because of the price. It's just there's some that I've seen where it's like purely organic and maybe it doesn't have fluoride in it, and it's a different. Like, I think those are usually a bit more expensive actually, but like most toothpaste that you will find at the store, just go for the cheapest one. And once you do, maybe even get that big one, that big. I don't want to say any brands, but like get that big one. It's like white and red, or some others have like little rainbow colors, but like it doesn't matter. Just get those, and you don't need a big chunk of toothpaste
Yeah.
on your thingy. All right, like a little pea-sized amount will suffice, and that will last you for months. Okay, and because you remember you're brushing in the morning and in the evening before bed.
And that's
Brushing in the morning and in the evening. That's 2 times, okay?
it's true.
Twice. Yeah, sorry, I interrupted.
No problem. That's actually true. Good emphasis. And then that's the thing, like the most important, I know there's the ones without fluoride, but you know what? I would not recommend those. I just stick to the ones with fluoride. Even the toothpaste that's like 15, 20 bucks can do the job. And just a small amount of toothpaste is sufficient. You don't have to fill up your whole toothbrush, just a small amount. Because what's doing the work is the brush. The brush is doing the work. It's like using, how do you use it? Like a mop. The mop does the work, but then the agent, the detergent helps. And that's kind of the analogy with a brush. The brush is doing the work, and the we call that toothpaste is just an additive just to make it a bit fresher. It's a bit more abrasive, so it removes more plaque. So it's a dual combination, but the brush is more important. So if you have no toothpaste, brush only.
That still works.
That still works.
Yeah. And like the huge amount of toothpaste you see, that little cute curvature, that's just like great marketing. Like how a McDonald's burger looks pretty on TV, but like, if you get it from the real, like can be soggy, it's just aesthetics. It has to look good. So just a little pea-sized drop and you should be dope.
And honorable mention to denture people. Let's say you manage to get yourself a set of dentures and you can't get something like denture cleaner. I won't mention brands, but you can't get yourself a denture cleaner. Dishwashing liquid. If you have any dental prosthesis, a retainer, a denture, whatever, just use dishwashing liquid, soft brush on it, you're good to go. And dunk it in warm salty water overnight. It's good enough.
Yeah.
And if you have gum swelling, you can also use warm salty water as well.
I was about to add on to that.
Yeah.
Like you don't always have to buy the expensive mouthwash, because some people even do react to it. Sometimes the taste is too strong, sometimes the alcohol as well. Just to reduce general inflammation around your gums, warm salted water will do the trick.
Indeed. So now, I think this is the last section, you're on a budget. So how do you get professional help if you are on the low budget?
Well, there are multiple things you could do. The first thing, try and save. Well, it'll take a little bit, but like try and save up. Get like $500 just to see one. Get a cleaning. You could go to Medunsa, you could go to Wits, you could go to UP or what's
UWC.
UWC. I think UKZN has
Oh yes, you did.
dental therapy as well.
That's
You could go to a training facility and just have one of the students see you. They're supervised by professors and experienced doctors. So you won't just be seeing kids who are experimenting around. They'll be following the proper protocol. You could also, instead of like just seeing a dentist, if you're in like a major city, you could find like a hygienist practice, and they usually do have like more affordable rates. And if you find yourself in like a township, there are also dental therapists. They do have more competitive prices. If you are close to any of those Pelo Pepper trains, you probably already know about that. But if you don't know about that, you probably are way too far to even get access to it.
Yeah, and sometimes there are outreach programs by different brands as well. So if you can hop on that, that will also be helpful, because those outreach programs, they usually do cleanings and give you some dental products. So yeah.
And some exams,
Yeah.
they'll let you know like, oh, okay, you do have cavities or you don't have cavities. You should be worried. You shouldn't be worried. Like just to know. Sometimes it's just better to know. Yeah.
And this is the best part about all this. Wherever there's a market, there is somebody who's going to fill it. So, like I said, there are dentists who are not charging 1 million rands for consultation. They do exist. And if you look around, if you need help, always feel free to reach out. We'll direct you. In fact, we know.
You're saying it like we cost R1 million.
We don't cost them.
We don't cost R1 million.
But like, let's say, you really need one, but your budget is low, right? And you can reach out to us, tell us what's your budget. If you want somebody, we know everybody, like legit. Not like everyone, but we know
Know somebody.
somebody because the whole community is small.
Yeah.
So, yeah, to that dentist who said that thing, I'm watching you. I know who you are. Sorry.
Okay.
No personal vendettas. Okay.
Alrighty. And that is all from today. Did I say from?
For
Yeah.
today.
My English data bundles have depleted, you know. But you can see, look what me, joined na munta. They were not sukulere nene. Ileka heels. Dental talk.
Thank you, everyone. And cheers.
Bye.
Bye.